Welcome back. Many of the symptoms of COVID-19 are similar to those of a regular cold. So when is it time to worry? Researchers at Stellenbosch University believe they've found a way of distinguishing between a COVID cough and a non-COVID cough. For more on this, one of the researchers, Dr. Marisa Klopper, joins me now for that conversation. Before we get underway, Prof, Dr. Klopper, it seems we have a bit of a Stellenbosch mafia happening on this program. Just a few minutes ago, you will have heard I was talking to Professor Resia Pretorius, also from Stellenbosch. Thank you for your time.
Yes, Stellenbosch is doing great research.
Thank you for your time. So I've been fascinated by this. What is this that you are talking about? With the work that you are doing, I should be able to cough and upload it somewhere or have it recorded some way. And what have you found? That I'll be able to tell between what's a normal, let's say in inverted commas, normal cough and a COVID cough?
Right, so we are busy developing an app that eventually will be used on your smartphone so that you will be able to cough to this app and it will be able to tell you whether it's COVID or not. So unfortunately, we're not quite at the app yet. We're still busy with data collection, but our preliminary results are really looking great. We can already predict with more than 90% accuracy whether it's COVID-19 or not.
With more than 90% accuracy?
That's right.
Wow. What are the main differentiators then between, you know that scenario where someone was standing in a queue and someone suddenly starts coughing? In the last 16 to 18 months, we all get, freaked out and you think, oh, could this be COVID? What are the differentiators that you've picked up?
So the signals that differentiates COVID from other coughs isn't audible by the human ear, and there are many different features in the audio signal that the computer can use to distinguish between the two. But what I can tell you, what's maybe most intuitive to us humans, is that the COVID cough appears to be about 15 to 20% shorter than other coughs on average.
And is that unexpected? Because I would imagine that people actually think that the COVID cough perhaps is deeper, has a bit more whizzing to it, and perhaps we would have expected that it would be longer. But you're saying it's actually shorter than the common cough. Yes,
so disclaimer, I'm a biologist, I'm not a medical doctor. The physiology of different coughs and how it affects the lungs is different. But personally, I can't really comment on what would have been expected. It was almost like just trying our luck to see if it would work, and clearly it does.
So what difference will this app make in terms of, taking precaution? Because I know that you've said that this will not replace the need for testing. There's no substitute for testing whether you've got COVID or not. But your thinking is that this makes a difference in early detection and people being able to isolate much earlier.
Right, so if you have the app, so the idea is to use it as a screening tool. In other words, if you're coughing and you're worried that it may be COVID, you can use the app to test. And then if it says you've got COVID, you should really go for your lab test, your PCR test, to confirm that it actually is COVID. The idea behind screening is to reduce the number of very expensive PCR tests that needs to be done. And also it can be done in your own home, so you don't need to go out and risk infecting other people if you are COVID positive, or on the other side, risk getting infected on your way to the testing station if you're not COVID positive. And I think it's convenient for people also who maybe don't have their own transport to testing stations and so on.
So how far are we from having to download this this app, and what other work do you still need to do, and how can South Africans participate?
So I always say research takes longer than I think. At the moment, people can participate in the data collection for improving our algorithm and eventually to test the app before it can be rolled out by signing up to a web link called coughtest.online. And this is a anonymous survey where we will be asking you some very basic questions about your health, and then you upload a recording of the cough. And then we can use this to improve our algorithm and to validate what we've already got.
Wow, this is incredible. And any idea of how far we are from the app actually being developed?
From start of development, maybe a couple of months, depending on the participation to the study. But as far as how long the app development will take, it would still need also validation of the app and user acceptability testing and so forth. And then, of course, we'd need approvals from the regulatory authorities before we can roll it out.
All right, I've got to thank you, Dr. Marisa Klopper from University of Stellenbosch. I'm glad we've had this Stellenbosch mafia situation going on all angles today. It has certainly stimulated the right areas in my brain around issues of the science of COVID-19. That is just simply mind-blowing that in the next few months or so, we'll be able to have an app into which you can cough, and it will be able to tell you with, pretty good accuracy whether you should worry about having COVID-19 or not. And of course, the scientists emphasize this will not substitute testing. So don't sit at home and say, I coughed into my app and it says I don't have COVID. No, that would be irresponsible. You should still go get tested if you think you've contracted COVID-19.